Hello everyone. Today I have a guest speaker with me, Dr. Prabhakar Devadiga sir. He is HOD and professor of Department of Organon of CMP Homeopathic Medical College. He is a gold medalist. He has a 38 years of teaching experience in homeopathy. His special interest is in psychiatry and orthopedic cases. He has presented many papers nationally and internationally. And today we are going to get inspired by Dr. Devadiga sir. So, sir, we as budding homeopaths want to ask you, what inspired you to pursue homeopathy? आपको क्या इंस्पिरेशन मिला जब आप एक होम्योपैथिक कॉलेज में थे कि होम्योपैथिक प्रैक्टिस ही करना है?
नहीं, जब हम ज्वाइन किए थे तो आई हैड नो आइडिया अबाउट होम्योपैथी मच डिटेल एंड कमिंग फ्रॉम ए स्मॉल टाउन and going to Bombay and trying to learn something was different. But the idea of learning medicine was always there. And slowly our teachers, when they were telling us things in a better way, definitely inspired to have a look in it. Initial concept was, okay, I will do this science and then pass out and maybe practice modern medicine. But once we started seeing the results, it inspired ki let me see if I can do this. And I had my teacher Dr. Anil Bhatia. He is no more now, but very good teacher. He was the principal of our college and he had a very heavy OPD. So when I went to the OPD first day, I saw so many patients and I asked him ki, sir, you are teaching organon and how come you can see so many patients? Meaning you are supposed to take history of each and every patient in detail and now you are taking shortcut. Then he first made me understand that which patient requires how much time you need to decide by patient. Today we call it as triage. In disaster management we call it triage. The word was not there, but before that he could tell me ki which patient needs attention more. So that was the first learning lesson, where how much time to invest in each patient. Sometimes we end up investing too much of time in a patient who does not require. Patient gets upset, you do not get the result and then you lose the patients. So this is one thing which I learned from him, which cases to take and which cases to pay attention to. It's very important. Now sir would pay very much attention to details in cases which are pathological. So then I understood that you really need to pay much attention to them, because there is a chance of proving yourself as a science, and not only that, that gives a better satisfaction than in cases of which are more of not pathological but more of functional diseases. So not that functional diseases are not troublesome. Please understand, we are not talking that. But a satisfaction where you can actually measure evidence based that way. Now one of the case which we saw many years ago was one young girl, 18-year-old girl from the far suburb, eastern suburb of our town. She was admitted for more than 6 months in Bombay hospital under the topmost neurosurgeon and neurologist of that time. And she had tuberculoma. Now this is a tumor which was there in the brain में था. The tumor की वजह से the patient had vomiting, because increased pressure, patient vomiting. And the medicines which are given for tuberculosis is simple. One was injectable, those days it was streptomycin, and others are rifampicin and INH, which the patient would vomit.
Yes.
So the patient को दवाई जा नहीं रही थी. ये simple logic है कि वो patient को जितनी दवा नहीं जाती, patient ठीक नहीं होता. Of 6 months, nearly 6 months, the patient was admitted there. The relatives had exhausted their resources, financial resources. And the child, the girl was deteriorating, because just IV fluids will not make you healthy. Yes. Patient loses the mass. Now this is very important to understand. So they came to our hospital and they brought the patient from there, because, and to interesting was, they also imported some injectable rifampicin those days. That's very interesting. But that also did not work. So there was no change. Now this was a time when CT scan had just newly come. MRI was not there. So CT scan had just newly come in our country, and uska CT scan nikala hua tha. Now this is, I'm talking about 1985-86. 85-86.
Yes.
Date.
CT scan had just arrived at that time.
Just arrived. उससे पहले CT scan था ही नहीं. तो अब समझ लो. And the patient आ गया, patient को लेके आए, सर ने देख लिया, कुछ सिम्टम्स पूछे और उनको बोला आयोडोफॉर्म दे दो. आयोडोफॉर्म 30. हमने आयोडोफॉर्म दे दिया, पेशेंट को एडमिट किए, पेशेंट को आयोडोफॉर्म दिया, तीसरे दिन वॉमिटिंग बंद, खाना खाना शुरू.
6 महीने से जो वोमिटिंग था वो.
हाँ, 6 महीने से जो वॉमिटिंग था. एंड इफ यू रीड नाउ आयोडोफॉर्म, यू विल फाइंड दैट इट इज गुड फॉर ट्यूबरकुलस brain affection and increase intracranial tension. And sir could connect the physical symptoms and the pathological symptom. Now that is very important to connect.
Yes.
So we connected that and prescribed that. The patient's vomiting stopped. Then we stopped the IV fluids after 4th day. The patient we kept the patient for a long time. Now let me tell you that in our hospital, those days the hospital charges were not much, and our hospital charges were negligible. And when the patient has spent that much, the patient would stay in the hospital. Today we don't keep the patient admitted for that long, but we kept the patient for nearly 3 months. Patient completely recovered, healthy, started walking, no walker, nothing. And we did this CT scan. Those days it was costly. It was costing those days 7 to 10,000.
Very costly in those days.
Costly. I do not really remember. It was costly. Today even MRI is cheaper than that day's CT scan. And we are talking about so many years ago the amount.
86,
So imagine the amount what is paid. So anyway it was done. Both the doctors came from Bombay hospital to see the patient. How did this patient improve? The tumor reduced in size. That gave me confidence to treat. And after that I have treated number of tuberculomas with good success. But that was the first patient where you get that confidence. Tuberculosis, tumor, brain tumor, vomiting, and your remedy, once single remedy, does the change.
30 potency.
30 potency, 3 days. After that, sir gave tuberculinum 1 1 dose, for which also there was a lot of what we call a peculiar disturbance in the homeopathic world. How can you give tuberculinum in a patient of tuberculosis? It was a healthy discussion, but there was a thought process which went. Today we are giving tuberculinum in tubercular patient, but that also. So no, a challenging case taken by a teacher who sat down without getting upset, gave the prescription, gave the result, showed the result to us. That was the first putting into path that no, we can do better. Now you understand that coming from a reputed hospital with the reputed physicians, and we are able to give the result. That the first thing which struck me: if sir can do it, we can do it. If sir can do something which is so much better than others, then this is a science where I can definitely be with my peers of the other science, and will be making some impression. And that is the day when the confidence of a student. I was just a beginner. It improved to an extent that we saw cases of renal failure in the OPD, in the IPD. We had a renal failure patient. Another cases, renal failure patients, creatinine was not going down. Patient was a union leader of escorts from New Delhi. Came and got admitted. To see him, the minister of the country came in here. I would not like to name because we do not want to name the ministers. But the minister came down to see him. So he was a VIP. Imagine that patient getting all right and walking. And because I was the house physician, I was seeing him daily, treated by again Dr. Bhatia sir. But we were involved in the solving cases. He gives me immediately 1 kg of cashew nut and going away. So these are the things which inspired, which motivated us to practice homeopathy, where we could see the result and we could see that we can also do that. So difficult cases are those. Now it came down to when I started practicing.
So any of your memorable or difficult cases?
So now what happens is that we get motivated. We get motivated from various sources. So one of the sources naturally are our teachers. There are good teachers. When we get motivated from them, we try to follow their path. Then the other motivation always comes from our own patients. So this is one patient whose name was Babu Ram Tiwari. I do not mind telling his name, but many years ago, again in 88. So that is also nearly 39 years ago. So this person walks with a jhola, comes and tells me, doctor, I got this cough and fever, I get evening rise of temperature, rigors, ना ठंडी लग रही है, तो मैंने एक्सरे भी निकाले हैं, जरा देखिए आप क्या कर सकते हैं होम्योपैथी का. तो आई सॉ हिम, तो मैंने बोला सर आपको ट्यूबरकुलोसिस है, टीबी है, छाती का टीबी है. तो उसने बोला फिर अभी क्या करना है? तो मैं बोला आपको ना हमारे हॉस्पिटल के सामने ही एलोपैथिक हॉस्पिटल है बड़ा, कूपर हॉस्पिटल, बोले वहाँ जाइए, वहाँ टीबी का इलाज होता है। नाउ सबसे बड़ा इंटरेस्टिंग चीज, ये पेशेंट बैठते हैं, बोला आपके होम्योपैथी में इसका इलाज है कि नहीं? A question was asked to me by a patient, layman, who asked कि आपके होम्योपैथी में इलाज होता है कि नहीं? बोला होता है, होम्योपैथी में ट्यूबरकुलोसिस के लिए दवा है, ऐसा हमने पढ़ा है, तो फिर देते क्यों नहीं? मैं बोला
पेशेंट इज गिविंग यू कॉन्फिडेंस।
यस, तो मैंने कहा नहीं सर, वो ऐसा है ना देने के लिए कि हम लोग हमारी दवा से श्योर नहीं, ऐसी मैं बिगिनिंग में था ना, स्टार्टिंग में, तो हमारी दवा काम नहीं करेगी, अगर बीमारी बढ़ गई तो दूसरों में फैल सकता है, ये फैलने वाली बीमारी है। तो मेरा एक लॉजिक था उसमें, तो मैं ये फैलने वाली बीमारी है, अब फैलने वाली बीमारी को क्या करेंगे? तो वो अगर नहीं लागू हुआ तो फिर नुकसान हो जाएगा। अभी पेशेंट का दूसरा सवाल, क्या एलोपैथी में सभी पेशेंट टीबी के दवा से ठीक होते हैं क्या? एंड टुडे दो वी हैव एमडीआर मोर, बट आई हैड नोन अबाउट एमडीआर इवन मल्टीपल ड्रग रेजिस्टेंट ट्यूबरकुलोसिस इवन इन 88, सो आई न्यू अबाउट इट। मैं बोला नहीं, सब पेशेंट नहीं ठीक होते, majority of patient would be all right today as compared to today, and वो लेकिन ऐसा होता है कि कुछ पेशेंट नहीं ठीक होते, तो उन्हें कैसे पता चलता है? दैट्स द थर्ड क्वेश्चन। सी द हाउ, व्हाट, व्हेन, दिस इज आस्क्ड बाय द पेशेंट। वो कैसे ठीक होते, वो कैसे मालूम पड़ता है, उनको कैसे मालूम पड़ता है कि ये पेशेंट ठीक हुआ? बोला वो ना साहब उनका एक्सरे निकालते हैं और उनका ब्लड टेस्ट करते हैं, ये सर अगर कम हुआ, वजन बढ़ा तो ठीक है, तो ये फिर आप आपकी दवा देके क्यों नहीं कोशिश कर सकते? ना इमेजिन ईच एंड एवरी स्टेप गॉड सेंट पेशेंट टेलिंग मी व्हाट टू डू। इट्स अ गुरु फॉर मी टुडे, इवन टुडे आई रिमेंबर विद लॉट ऑफ रेस्पेक्ट फॉर दैट पर्सन हु टॉट मी दैट व्हाई यू आर नॉट यूजिंग योर लॉजिक। ये लॉजिक यूज करके उन्होंने मुझे सही रास्ते दिखाया। तो फिर मैंने हिस्ट्री ले लिया और उनको काली कब आया। मैंने काली कब डरते डरते एक डोज दिया, तो पेशेंट ने अपने झोले में से 10 बॉटल एम्बिस्ट्रिन करने का, एम्बिस्ट्रिन वाज ब्रांड नेम फॉर स्ट्रेप्टोमाइसिन, बोला मैंने दवा भी लिया हूँ लेकिन मुझे होम्योपैथी ही लेना है। नाउ इमेजिन कि एक पेशेंट इतने दूर से आके मुझे सब समझा के दवा लेने के बावजूद उसको होम्योपैथी लेना है, अब ये गॉड सेंड ही होगा, बराबर, ये कोई और नहीं हो सकता, फरिश्ता ही होता है। तो वो लिए, उसके बाद 1 महीने के बाद his X-ray interestingly had not pneumothorax, he had pleural effusion. वो pleural effusion was there, pleural effusion disappear हो गया, उनका ESR which was 40 came to 5, उनके weight 5 किलो बढ़ गया, कफ disappear हो गया, fever disappear हो गया। अब ये रिजल्ट है काली कप सिंगल डोज से। अब देखने जैसी बात है, तो उसमें कुछ और सीखना था मुझे। बोले पेशेंट तो ठीक हो गया, मैंने फिर मेरे एक सीनियर मेडिसिन के डॉक्टर से पूछा कि सर ये एक्सरे, ये पेशेंट ऐसा ऐसा है, तो बोले तो क्योर हो गया। बोले सर 9 महीने दवा देने होते हैं, उस जमाने में 9 महीने दवा देते थे, तो 9 महीने दवा देना है। बोले नहीं, देखो ये एक्सरे में और ये इसके रिजल्ट में क्योर हो गया। अब मैं अचंभे में पड़ गया कि 1 महीने में ठीक होगा। क्वेश्चन तो ये था कि 1 महीने में कैसे ठीक हुआ, तो मैंने तो डोज एक ही दिया, कौन से दिन ठीक हुआ। See the interesting part of it. So ये जो learning हुआ ना, that again helped me that कि the changes can be instantaneous. And that I saw in a patient in our another OPD. We had a Nigerian student who was studying, हमारे पीछे हॉस्टल है, वहाँ से आ गया, वो उनको जॉन्डिस हुआ, और ये जो they are dark colored, हमसे बहुत ज़्यादा डार्क कलर है, तो उनका स्क्लेरा जो है ऑरेंज लगता है, पीला नहीं होता, तो वो डार्क कलर में ऑरेंज दिखता है। 5.2 उनका बिलिरुबिन था, और वो आया मुझे, यू गिव मी ट्रीटमेंट, मुझे आई नो दैट दिस इज 1 डे हॉस्पिटल, हमारे हॉस्पिटल को 1 डे हॉस्पिटल बोला जाता था, 1 डे हॉस्पिटल कि आप एक दिन में ठीक करते हो। नो ये आइडिया उसका वो एक अलग स्टोरी है, लेकिन वो आइडिया उनको स्टूडेंट्स लोग को आ गया था, नाइजीरियन स्टूडेंट्स को। तो बोले मुझे दवा दे दो, हमने हिस्ट्री ले लिया, मैग्म्यूर दिया, ब्लड टेस्ट तो करा लिए थे, नेक्स्ट डे आया तो उसको स्क्लेरा सफेद। नाउ दिस विल अपीयर लाइक ए मैजिक और जोक, इट इज नॉट। ये क्या हो गया? आई सेंड दिस रिपोर्ट टू द पैथोलॉजिस्ट, तो पैथोलॉजिस्ट दौड़ता है, ये किसका दवा, किसका ब्लड टेस्ट है, ये पेशेंट का नहीं है। मैं बोला सर आपने ही लिया पेशेंट का, कल भी आपने लिया, आपने ये तो, लेकिन ऐसा कैसे हो सकता है? एक ही दिन में उसका बिलिरुबिन नॉर्मल कैसे हो सकता है? एक ही दिन में उसका एसजीपीटी नॉर्मल हो सकता है? तो ये हो सकता है। तो ये मैंने यहाँ वो पेशेंट से ये सीखा कि आवर रेमेडीज एक्ट फास्ट,
they are instantaneous.
इंस्टेंटेनियस। ये जो ब्यूटी है ना, ये जो पेशेंट्स ही सिखा सकते हैं हमको। इसमें कोई बुक्स तो हम लोग पढ़ सकते हैं, लेकिन बुक्स से ज़्यादा पेशेंट हमको सिखा के जाता है कि ये आपके जो लॉ है वो अटल है, वो है। वो जब आप अप्लाई करोगे तो आपको सीखने मिलेगा। तो रॉबर्ट्स
से अप्लाई करना है।
हाँ, रॉबर्ट्स जो सिखाते हैं ना, वो सही सिखाते हैं कि एज ए फिजिशियन डू नॉट एक्सपेक्ट कि व्हाट होम्योपैथी गिव्स टू मी, व्हाट होम्योपैथी विल गिव टू मी, विल गिव मी अ चांस टू कंफर्म द नेचुरल लॉज, एंड दैट इन टर्न विल गिव ऑल द थिंग्स इन योर लाइफ। सो ये जो सीखा हुआ ना, ये मुझे यहाँ सीखा हुआ मिला।